Hello, this is Betsy Bates from Global Medical News Network reporting from an annual cosmetic dermatology seminar sponsored by the Skin Disease Education Foundation. I'm here with Dr. Christopher Zachary, professor and chairman of dermatology at the University of California at Irvine. The seminar sponsored a face-off between 4 different fractionated lasers to see how they measured up in a face-to-face comparison with patients with wrinkles as well as scarring. Can you tell us what the results were of the face-off?
Absolutely. Thank you very much. Appreciate the question. I will tell you that this is one of the first times that we've been able to compare on the same patient with the same laser surgeon, one laser on one side of the face with a different laser on the other side of the face. And I must tell you that we used 4 of the best fractionated laser systems out there. We've got very good images, great video. I'll be seeing these patients on a daily basis subsequently. And we'll be able to tell, pretty much for the first time, just how quickly these patients heal up, what the long-term results are, the discomfort, the potential for complications, and so forth. So this sort of face-off is actually very important, and it's just the typical sort of thing that we want to do here at the Skin Disease Education Foundation in these educational events where we have hundreds of people in the audience who can see live with absolutely all the nuts and bolts there. They can see exactly how it's done in real time, and they can understand for themselves what will make, in practice, what will make the right choice for their own practice in terms of the equipment, techniques, patient choice, and so forth.
Yes, and one of the observations that I made while watching the demonstration was that there were certain differences, even though you were trying to dial in the same amount of joules, the same energy, the same spot size. There are differences in such things as the tips, and when you actually were watching them being used one after another, what were some of the differences that you noticed that the doctors were encountering?
Well, I'll tell you that some of these devices have been engineered so that they're really ergonomically nice to hold, they're easy to use, you get very, very nice even scanning. Others are a little bit heavier, a little bit more clumsy, etc., but might have other benefits. So I think, again, from the audience point of view, and in terms of the video that we're going to use in our enduring material, people will be able to see in real time the different devices, to see how even in expert hands some devices are easier to use than others. They can decide whether a scanning device is better or worse than a stamping device. They can look at the different areas, whether you're just treating the lips locally, for instance, or the entire face, which device is going to be right for them. So there are differences in design, and I think I want to tell you that it's great to see so many companies coming in here with these new fractionated devices, because with time and with the wonderful brilliance of the laser engineers out there, we're going to see better and better devices with nicer scanning and nicer outcomes.
Wonderful. Thank you very much for your observations. This is Betsy Bates from Global Medical News Network, reporting from an annual cosmetic dermatology seminar sponsored by the Skin Disease Education Foundation.